We were in double digits, upper 9, low 10% readmission rate. Over the last 3 years, we've taken that from 10% down to about 2%.
The data will tell us what your readmission rates are. It will tell you even what people are coming back for. We developed this program from scratch based on what were our needs, what were our community needs.
Our director of quality improvement had studied this, had a very strong hunch about what we could do to mitigate and improve our readmission rate. As our patients come into our system, discharge them with instruction, follow them into the home.
In 2015, my mother had pneumonia. So I was on the patient caregiver side of that. And you're so overwhelmed with everything that's going on in the situation. When you're given discharge instructions, a lot of times they go in one ear and out the other, and you figure you'll deal with it later. A lot of patients don't deal with it later, don't know how to deal with it later. They implemented some additional education in the community, bridging that gap, making sure they understand the instructions, making sure that they have the resources that they need at home.
Like physical therapy come in and work with you?
Yeah.
Which you can't tell until you get into that patient's home.
Which is why we make our visit. We come to the house like, I think they told me this, but can you show me one more time? Like, sure, that's why we're there. And we always use the teach back method. Can you just tell me what I explained to you about that wound? And make sure there's a good understanding there, and if there's not, start over. Let's talk about it a different way. We even do play acting. Well, okay, if you get short of breath next time, what are you going to do? I get a feeling like they are more confident.
Having that transition care nurse come in and help you interpret the information, make sure that you have the resources to do what you need to do, that's led to the success of the program.
Like you have everything you need for heading back to home alone, but can I give you a call?
As transitional nurses, we like to see how we're affecting that readmission rate if the program is successful.
You take care.
We're just getting wiser, using data to our advantage. We can predict and prevent rather than react and respond to people showing up in our ER or the doctor's office.
This is the best she's felt in a while.
That's
amazing.
Not only treating the people who are ill, but maintaining health, improving health, being the healthiest community that we possibly can. The goal is really collaboration, not only within our organization, but without our organization.
We can go out into the community and work with our employers, school systems, faith community, city governments, and saying, how can you help us realize our vision of becoming the healthiest community in Wisconsin? That will do as much for economic development in this community as anything else that I can do.
One of the important aspects of teaching people at home and families at home is that they can be their own advocates. We need to tell people, it's your body, it's your health. And we need to give them permission to take hold of this and say, this is what's happening with me, and this is what I need.